Hello and welcome. My name is Dr. Fred Foley, and I'm a professor of psychology at Yeshiva University in the Bronx, New York, and the director of neuropsychology at the Holy Name Medical Center, Multiple Sclerosis Center in Teaneck, New Jersey. I am here today to talk to you about discussing difficult and sensitive subjects with your healthcare team and your family. Specifically, I'm here to talk about how do you talk about sexuality and sexual function. Sexual dysfunction is very common in MS. Up to 80% of persons with MS in our studies and in other large-scale epidemiological studies indicate that at least occasional or most of the time even, people with MS will experience different types of sexual concerns. So I'm starting out with this because the first important thing to getting help with this and being able to talk to your healthcare provider about it and your family is knowledge and education about what kinds of things can happen, and that will set the stage and give you a language to be able to talk about it more clearly, with more comfort, and that will also then lead to treatments for it for you and your partner. So, to begin with, I would just like to say that there are different types of sexual problems or concerns that occur in MS. There can be problems with arousal, sexual arousal. Formerly, you were able to get aroused, and now, after the onset of MS, you cannot. Or there could be problems with sexual desire, just the loss of interest, or what we call libido, in having sexual or intimate relationships with a partner. Or there can be difficulties with orgasm. Formerly, you were able to orgasm easily, and all of a sudden that's disappeared in your life. And these can be caused by many different reasons associated with multiple sclerosis. There are primary sexual problems, and primary problems we define as occurring related to lesions that directly impact sexual functioning. For example, lesions in the sacral area of the spine will decrease sensation and in the genital area and impair sexuality. There are also secondary sexual concerns, and secondary problems are MS-related symptoms that aren't going to affect sexuality directly due to lesions, but indirectly. For example, if you have significant fatigue, you're not going to be feeling very much like having intimate relations on days when your MS-related fatigue is very strong, or spasticity, or other symptoms in MS that will interfere in sexual enjoyment and satisfaction. Finally, there are tertiary sexual problems in MS, and tertiary problems are psychosocial and cultural issues that can interact with MS and cause difficulties in talking about sexuality, or difficulties with body image or self-esteem, or difficulties with performance anxiety that can interfere in sexual performance and enjoyment. So, how do you talk about these problems more comfortably with your healthcare provider? First, it's important for you to get educated about the kinds of sexual problems that can occur in MS so that you can identify these things when they happen. So there are many books, professional pamphlets, and other informational materials that have been written by MS professionals and are available through a variety of MS organizations, both in the United States and internationally. So start there. Call your local MS society or other MS organization and have information, learn about these problems that can occur in MS. That will help give you a language and help you determine whether or not you have these problems. Second, before you go see your provider about these problems, write them down. Sometimes seeing a healthcare provider is associated with anxiety, and you kind of forget what you want to talk about or what's important to you. So write them down. Make a list ahead of time to make sure you bring it up with your provider. Next, many healthcare providers have electronic medical record systems that you can email them problems ahead of time. If your provider has that, then let them know ahead of time what kinds of concerns you're going to bring up at the meeting. It will help reduce your anxiety at the meeting when you've already informed your healthcare provider about it. Next, consider bringing your partner with you to your physician or other healthcare provider. Sometimes partners will be less anxious about bringing up your concerns and be able to kind of monitor what your healthcare provider says so that you have complete information when you leave. Also, do not be concerned about your healthcare provider's comfort. We have found by interviewing persons with MS, they're concerned that their healthcare providers at times won't be comfortable with the topic of sexuality. And yet our studies have indicated that even if they're not going to ask you about this, if you bring it up, they will do their best to help you with these problems, whether they're comfortable or not with the topic. And they will provide you with education and/or referrals to persons that can help you with this topic. So there is help available. It all starts with your knowledge about the topic, becoming educated, becoming more comfortable with the topic yourself, and preparing yourself before the medical visit so that you can communicate these issues with your healthcare provider.